Imagine a bustling city, a network of roads and highways buzzing with activity. Now, picture a sudden and unexpected roadblock, halting the flow of traffic and causing chaos. This, in essence, is what happens during a stroke or palsy, a disruption in the intricate network of our nervous system. Strokes and palsies are serious neurological conditions that affect millions of people worldwide. When this delicate balance is disrupted, the consequences can be devastating. Strokes occur when the blood supply to a part of the brain is interrupted, depriving brain tissue of oxygen and nutrients. Just like a plant withers without water, brain cells begin to die within minutes of a stroke. There are two main types of strokes: ischemic and hemorrhagic. Ischemic strokes occur when a blood clot blocks an artery supplying blood to the brain. Hemorrhagic strokes occur when a blood vessel in the brain ruptures, causing bleeding. Recognizing the signs of a stroke is crucial. The acronym FAST helps remember key symptoms. Facial drooping. Is one side of the face drooping or numb? Arm weakness. Is one arm weak or numb? Speech difficulties. Is the person's speech slurred? Time to call 911. If you observe any of these signs, call 911 immediately. Palsies affect the nerves controlling muscles, leading to weakness, paralysis, or uncontrolled movements. Motor neurons transmit signals between the brain and muscles, initiating voluntary movements. Disrupted pathways cause muscle weakness or paralysis, affecting movement and balance. Palsies can impact the face, limbs, and torso, ranging from mild to severe. Bell's palsy affects the facial nerve, causing sudden facial muscle weakness or paralysis. It is thought to be triggered by a viral infection causing nerve inflammation. Cerebral palsy affects muscle movement and coordination due to brain damage. Symptoms vary from mild clumsiness to severe disability. The importance of early identification and treatment for both strokes and palsies cannot be overstated. Prompt medical attention can significantly improve outcomes, reduce the risk of long-term disability, and enhance the chances of a full recovery. In the case of strokes, time is brain, meaning that the longer a stroke goes untreated, the more brain cells are irreversibly damaged. Early intervention with clot-busting medications or other procedures can restore blood flow to the brain and minimize the extent of brain injury. For palsies, early diagnosis allows for timely rehabilitation and supportive care, which can help individuals regain lost function, adapt to their condition, and improve their quality of life. Physical therapy, occupational therapy, and speech therapy are often essential components of palsy management, helping patients improve muscle strength, coordination, and communication skills. Recognizing the signs and symptoms of strokes and palsies is often the first step towards seeking medical attention. While some symptoms may be subtle and difficult to detect, others can be more pronounced and alarming. Being aware of these warning signs and understanding their significance can make all the difference in ensuring timely intervention and improving patient outcomes. Section 5. The road ahead. In the following sections, we will delve deeper into the different types of strokes and palsies, exploring their clinical presentations, associated brain lesions, and diagnostic methods. By understanding the complexities of these neurological conditions, we can empower ourselves with the knowledge to recognize the signs, seek timely medical attention, and support those affected by these debilitating disorders. Our journey begins with a closer look at the different types of strokes, their underlying mechanisms, and the telltale signs that distinguish them from other neurological conditions. From the devastating effects of hemorrhagic strokes to the more common but equally concerning ischemic strokes, we will unravel the mysteries of these brain attacks and highlight the importance of prompt medical intervention. Table of Contents, Part 2, Act 1, about 7 sections. 1. A river runs through it, understanding blood flow in the brain. 2. Ischemic strokes, when the river runs dry. 3. Hemorrhagic strokes, when the levee breaks. 4. Transient ischemic attacks, a warning shot across the bow. 5. Clinical clues, recognizing the signs of stroke. 6. Time is brain, the importance of rapid response. 7. Looking ahead, navigating the path to recovery. Understanding blood flow in the brain. Imagine the brain as a bustling metropolis, neurons firing signals at lightning speed. Blood vessels deliver oxygen-rich blood to every corner. They carry oxygen and glucose, the brain's primary energy source. Even a brief interruption can lead to neuronal damage. Section 2. Ischemic strokes. When the river runs dry. Ischemic strokes occur when blood flow to a part of the brain is blocked. Imagine a dam obstructing a river, cutting off the water supply. Similarly, a blood clot in a narrowed artery blocks blood flow to the brain. This blockage prevents oxygen and nutrients from reaching brain cells. Without these resources, brain cells begin to die, causing neurological deficits. Section 3. Hemorrhagic strokes. When the levee breaks. Hemorrhagic strokes occur when a blood vessel in the brain ruptures, causing bleeding. Imagine a levee breaking, unleashing a torrent of water. Similarly, blood leaks into the brain, damaging cells and disrupting function. This bleeding creates a cascade of problems. The escaped blood irritates brain tissue, causing swelling and increased pressure. This pressure can compress delicate brain structures, leading to complications. Section 4. Transient ischemic attacks, a warning shot across the bow. Transient ischemic attacks, often referred to as mini-strokes, are temporary episodes of stroke-like symptoms caused by a temporary blockage of blood flow to the brain. Imagine a brief interruption in the city's power grid, causing flickering lights and momentary disruptions. Similarly, in a TIA, blood flow to a part of the brain is temporarily interrupted, causing a brief episode of neurological dysfunction. These temporary blockages, much like a rolling brownout in our city, are often caused by a small blood clot that dissolves on its own or by a temporary spasm of a blood vessel. While the symptoms of a TIA typically resolve within minutes to hours, they should never be ignored, as they are a strong warning sign of an impending major stroke. The symptoms of a TIA are identical to those of a stroke, but are temporary and resolve completely without leaving any permanent damage. However, TIAs should be considered a medical emergency, as they significantly increase the risk of experiencing a full-blown stroke in the near future. Individuals who experience a TIA require immediate medical attention to determine the cause and initiate preventive measures to reduce the risk of a subsequent stroke. This often involves lifestyle modifications, such as controlling blood pressure and cholesterol levels, and in some cases, medications to prevent blood clot formation. Section 5. Clinical clues. Recognizing the signs of stroke. Recognizing the signs and symptoms of a stroke is crucial for prompt diagnosis and treatment. The acronym FAST is a simple yet effective way to remember the key warning signs of a stroke: facial drooping, arm weakness, speech difficulties, and time to call 911. Ask the person to smile. Does one side of their face droop? Ask them to raise both arms. Does one arm drift downward? Ask them to repeat a simple sentence. Is their speech slurred or difficult to understand? If you observe any of these signs, even if they are fleeting, call 911 immediately. Every minute counts when it comes to stroke treatment. Other signs include sudden numbness or weakness, confusion, trouble seeing, dizziness, loss of balance, and severe headache. Stroke symptoms can vary significantly from person to person. Any sudden onset of neurological deficits should be taken seriously. Immediate medical attention should be sought. Remember, recognizing the signs can save lives. The phrase "time is brain" underscores the critical importance of rapid response in stroke management. Every minute that passes after a stroke begins, millions of brain cells die. Prompt diagnosis and treatment are essential for minimizing brain damage. When a stroke occurs, the brain is deprived of oxygen and glucose. This deprivation triggers a cascade of events leading to neuronal damage. Rapid response begins with recognizing the signs and immediately calling 911. Emergency medical services can initiate critical interventions and transport the patient to the nearest stroke center. Stroke centers have dedicated teams available 24/7 to diagnose and treat strokes. These centers can administer clot-busting medications and perform procedures to remove blood clots. Quick action can significantly improve outcomes. The journey after a stroke can be challenging. requiring dedication, patience, and a comprehensive approach to rehabilitation. Stroke recovery is a marathon, not a sprint. Rehabilitation plays a crucial role in helping stroke survivors regain lost skills. The type and intensity of rehabilitation vary depending on the severity of the stroke. Common therapies include physical therapy, occupational therapy, speech therapy, and cognitive rehabilitation. Physical therapy improves strength, coordination, balance, and mobility. Occupational therapy focuses on regaining independence in daily activities. Speech therapy addresses difficulties with speech, language, and swallowing. Cognitive rehabilitation targets skills such as memory, attention, and problem solving. Stroke recovery is an ongoing process. Celebrate small victories along the way. With patience, perseverance, and support, stroke survivors can reclaim their lives. Imagine a puppeteer meticulously controlling the strings of a marionette, bringing it to life with graceful movements. Now picture those strings becoming tangled or severed, disrupting the connection. This is what happens in palsies, a disruption in the communication between the brain and the muscles. Palsies affect the nerves controlling our muscles, leading to weakness or paralysis. Motor neurons carry signals from the brain to the muscles. When these signals are disrupted, muscles can't function properly. Unlike strokes, palsies are caused by nerve damage or dysfunction. This damage can result from trauma, compression, inflammation, or genetic disorders. Symptoms vary based on the location and severity of the nerve damage. Some may experience mild weakness, others complete paralysis. Palsies can affect any part of the body, including the face, limbs, and muscles involved in breathing and swallowing. Recognizing symptoms is crucial for prompt medical attention and treatment. Early intervention is key for optimizing outcomes. Therapies can help individuals regain function and adapt to their condition. With the right support, individuals and families can navigate challenges and embrace a future filled with possibility. Bell's palsy causes one side of the face to droop like a mask has slipped. It happens when the facial nerve becomes inflamed or compressed. Imagine waking up with a crooked smile and trouble closing one eye. Bell's palsy can strike suddenly and without warning. It's often triggered by a viral infection, like the herpes simplex virus. The good news is it's usually temporary. Most people recover within 3 to 6 months. Cerebral palsy, unlike Bell's palsy, is not a temporary condition but rather a lifelong disorder that affects muscle movement and coordination. It arises from damage to the brain that occurs before, during, or shortly after birth, typically affecting areas responsible for controlling motor function. Imagine a child struggling to walk, their legs stiff and uncoordinated, or a teenager with slurred speech and difficulty writing. Cerebral palsy manifests in diverse ways, impacting individuals across a wide spectrum of severity. The causes of cerebral palsy are varied and often multifactorial, involving a complex interplay of genetic and environmental factors. Some common causes include premature birth, low birth weight, infections during pregnancy, and lack of oxygen during birth. Cerebral palsy is a non-progressive condition, meaning that the brain damage itself does not worsen over time. However, the symptoms may change as the child grows and develops. Treatment focuses on managing symptoms, maximizing function, and improving quality of life. Erb's palsy, a type of brachial plexus palsy, serves as a poignant reminder of the vulnerability of newborns during labor and delivery. It occurs when the nerves that control the arm and hand, collectively known as the brachial plexus, are stretched or torn during childbirth. Imagine a newborn with one arm hanging limply by their side, their hand turned inward. This characteristic posture, often referred to as waiter's tip, is a telltale sign of Erb's palsy. Erb's palsy typically occurs during difficult deliveries, particularly when the baby is large or in a breech position. Shoulder dystocia, a complication where the baby's shoulder becomes stuck behind the mother's pubic bone, is a common cause. The severity of Erb's palsy can range from mild weakness to complete paralysis of the affected arm. Most infants with Erb's palsy recover fully with time and physical therapy. However, some may experience lasting weakness, limited range of motion, or differences in arm growth. Treatment for Erb's palsy focuses on protecting the affected arm, preventing contractures, and promoting nerve regeneration. Gentle exercises and stretches, along with occupational therapy, can help improve muscle strength, coordination, and function. Klumpke's palsy, another type of brachial plexus palsy, affects a different set of nerves than Erb's palsy, resulting in a distinct pattern of weakness. It occurs when the nerves that control the muscles of the forearm and hand, particularly those responsible for gripping, are damaged. Imagine a baby struggling to grasp objects, their hand curled inward, unable to fully extend their fingers. This weakened grip, often accompanied by a claw-like appearance of the hand, is characteristic of Klumpke's palsy. Klumpke's palsy is less common than Erb's palsy and typically occurs when the baby's arm is pulled upward during delivery. This can happen during a breech delivery or if the baby's arm becomes entangled in the umbilical cord. The severity of Klumpke's palsy can vary depending on the extent of nerve damage. Some infants may experience mild weakness, while others may have complete paralysis of the affected hand. Treatment focuses on promoting nerve regeneration, preventing contractures, and maximizing hand function. Todd's paralysis, unlike other palsies discussed thus far, is a temporary condition that follows a seizure. It involves a period of weakness or paralysis in the part of the body controlled by the brain region where the seizure originated. Imagine a person experiencing a seizure involving their right arm, followed by a period of weakness or paralysis in that same arm after the seizure subsides. This transient paralysis, typically lasting from minutes to hours, is the hallmark of Todd's paralysis. The exact mechanism underlying Todd's paralysis remains unclear, but it is thought to be related to the exhaustion of nerve cells in the affected brain region during the seizure. As these nerve cells recover, the paralysis gradually resolves. Todd's paralysis is not a sign of permanent brain damage and typically resolves completely without any specific treatment. However, it is essential to seek medical attention after a seizure to rule out other potential causes of weakness or paralysis. Palsies, with their diverse causes and presentations, can be challenging to diagnose and manage. Recognizing the signs and symptoms of different types of palsies is crucial for seeking prompt medical attention and ensuring appropriate treatment. While some palsies, like Bell's palsy and Todd's paralysis, are temporary and resolve on their own, others, like cerebral palsy and brachial plexus palsies, require long-term management and rehabilitation. Early intervention is key for optimizing outcomes in palsies. Physical therapy, occupational therapy, speech therapy, and other supportive measures can help individuals regain lost function, adapt to their condition, and achieve the best possible quality of life. The journey with palsy can be daunting, but with the right support and resources, individuals and families can navigate the maze of challenges and embrace a future filled with possibility. Imagine the human brain as a vast tapestry woven with billions of nerve cells. Each thread represents our thoughts, emotions, movements, and senses. Now, picture a spill of ink disrupting this delicate fabric. This is what happens with brain lesions. Lesions disrupt normal brain function caused by strokes or other conditions. They vary from tiny areas to large swaths of damaged tissue. The location and size of a lesion determine specific neurological deficits. Ischemic strokes occur when a blood clot obstructs a blood vessel supplying a specific brain region. This blockage starves the downstream brain tissue of oxygen and glucose. Deprived of these nutrients, brain cells begin to die, leaving behind a scar known as an infarct. This is the aftermath of an ischemic stroke, robbing individuals of their ability to move, speak, and interact. The body attempts to heal, but the brain's regenerative capacity is limited. Hemorrhagic strokes, unlike ischemic strokes, result from bleeding within the brain, painting a stark and often deadly picture on the brain's canvas. Imagine a burst pipe flooding a pristine art gallery, damaging precious paintings and sculptures beyond repair. This is the devastating impact of a hemorrhagic stroke, an event that can rapidly transform the brain's delicate landscape into a scene of chaos and destruction. The bleeding, often triggered by a ruptured aneurysm or uncontrolled high blood pressure, spills blood into the surrounding brain tissue, creating a mass effect that compresses and damages delicate brain structures. This blood, like a foreign invader, irritates the brain, triggering inflammation and swelling that further exacerbate the damage. Hemorrhagic strokes can manifest in two main forms: intracerebral hemorrhages, where bleeding occurs within the brain tissue itself, and subarachnoid hemorrhages, where blood spills into the space surrounding the brain. Both types can have devastating consequences, leading to a range of neurological deficits, including headache, nausea, vomiting, seizures, and loss of consciousness. The prognosis for hemorrhagic strokes depends on the location and extent of the bleeding, as well as the speed of diagnosis and treatment. Prompt medical attention is crucial for controlling bleeding, reducing pressure on the brain, and minimizing long-term damage. Section 4. Cerebral palsy, a blueprint gone awry. Cerebral palsy, unlike strokes, is not caused by a sudden event, but rather by damage to the developing brain, often occurring before, during, or shortly after birth. This damage, like a flaw in an architect's blueprint, alters the brain's wiring, affecting muscle movement, coordination, and posture. Imagine a building constructed with misaligned walls, uneven floors, and doors that don't quite close properly. This is the essence of cerebral palsy, a condition that leaves individuals grappling with physical limitations throughout their lives. The brain lesions associated with cerebral palsy are often subtle and may not be readily apparent on brain imaging scans. However, these lesions, though hidden from plain sight, have profound implications for brain function. They disrupt the intricate communication pathways between the brain and the muscles, leading to a wide range of motor impairments. The severity of cerebral palsy varies widely, from mild clumsiness to severe physical disability. Some individuals may experience spasticity, characterized by stiff and tight muscles, while others may have involuntary movements or difficulty with balance and coordination. While cerebral palsy is a lifelong condition, early intervention with physical therapy, occupational therapy, and other supportive measures can help individuals maximize their potential and achieve the best possible quality of life. Bell's palsy, a sudden and often perplexing condition, arises from inflammation or compression of the facial nerve, the nerve responsible for controlling the muscles on one side of the face. This disruption, like a temporary storm disrupting a power line, leads to weakness or paralysis of the facial muscles, causing one side of the face to droop. Imagine a portrait with one side perfectly rendered, while the other half appears distorted and asymmetrical. This is the outward manifestation of Bell's palsy, a condition that can temporarily rob individuals of their ability to smile, frown, or express emotions fully. While the exact cause of Bell's palsy remains unknown, it is often attributed to viral infections, particularly the herpes simplex virus, the same virus responsible for cold sores. The virus is thought to trigger inflammation of the facial nerve, disrupting its ability to transmit signals to the facial muscles. Fortunately, Bell's palsy is typically temporary, with most individuals experiencing significant improvement within a few weeks and full recovery within 3 to 6 months. The brain, in this case, exhibits remarkable resilience, able to weather the storm and restore normal nerve function. Section 6. The evolving landscape, how lesions shape the future. Brain lesions, whether caused by strokes, palsies, or other neurological conditions, are not static entities frozen in time. They are dynamic landscapes, constantly evolving and influencing the brain's ability to adapt and recover. Understanding this dynamic interplay between lesion and recovery is crucial for developing effective treatment strategies and maximizing patient outcomes. Imagine a landscape architect tasked with restoring a garden after a storm. They must assess the damage, remove debris, and nurture the surviving plants, all while anticipating future challenges and adapting their approach accordingly. Similarly, neurorehabilitation specialists act as the brain's landscape architects, guiding patients through the recovery process and harnessing the brain's inherent plasticity to promote healing and functional restoration. The brain possesses a remarkable ability to rewire itself, forming new connections and rerouting signals around damaged areas. This phenomenon, known as neuroplasticity, is the cornerstone of stroke and palsy rehabilitation. By engaging in targeted exercises and activities, patients can stimulate neuroplasticity, strengthen existing connections, and forge new pathways for recovery. The journey of brain recovery after a lesion is often long and arduous, requiring patience, perseverance, and the unwavering support of loved ones. However, by understanding the evolving landscape of the brain and harnessing the power of neuroplasticity, individuals can navigate the challenges of recovery and reclaim their lives. Imagine a detective at a crime scene uncovering clues to solve the mystery. Similarly, neurologists use diagnostic tools to piece together the puzzle of strokes and palsies. From bedside exams to imaging techniques, each tool reveals crucial information. The process is like assembling a jigsaw puzzle, each test adding to the overall picture. The neurological examination is a testament to the power of observation. Like a sculptor, neurologists use their senses to assess a patient's neurological function. By observing a patient's gait, a neurologist might detect a subtle limp. The neurologist will examine the patient's cranial nerves. The examination assesses motor function, including muscle strength and reflexes. Neuroimaging techniques like CT and MRI have revolutionized the diagnosis of neurological disorders. These technologies allow us to visualize the brain's structure and function in remarkable detail. CT scans create cross-sectional images to detect bleeding, tumors, and other abnormalities. MRI uses powerful magnets to generate detailed images, detecting strokes and multiple sclerosis lesions. Functional MRI measures brain activity by detecting changes in blood flow. Neuroimaging is crucial in diagnosing and managing strokes and palsies. Section 4. Electrodiagnostic tests, deciphering nerve signals. Imagine listening to a symphony orchestra, each instrument contributing its unique voice. Now picture a single instrument playing out of tune, disrupting the balance. Electrodiagnostic tests like EMG and NCS act like conductors, detecting discordant notes in the nervous system. These tests assess nerve and muscle health, pinpointing nerve damage and distinguishing disorders. EMG and NCS are valuable for diagnosing conditions affecting the peripheral nervous system. EMG involves inserting a needle electrode into a muscle to record its electrical activity. These recordings provide information about the muscle's electrical health. NCS measures the speed and strength of nerve impulses. Small electrical pulses are applied to a nerve, and responses are recorded. EMG and NCS help determine if weakness is due to nerve or muscle damage. Section 5. Lumbar puncture. Tapping into the spinal fluid's secrets. The cerebrospinal fluid, or CSF, surrounds the brain and spinal cord, serving as a protective cushion and nutrient delivery system. Lumbar puncture, or spinal tap, provides clues about neurological conditions. It offers a window into the brain's biochemical environment, diagnosing infections and abnormalities. The clinician inserts a needle into the lower back to access the spinal canal. A small amount of CSF is collected for laboratory analysis. Section 6. The power of integration. Piecing together the puzzle. Diagnosing strokes and palsies is rarely a straightforward process. It often involves piecing together clues from a variety of sources, like assembling a complex jigsaw puzzle. Each diagnostic tool, from the simple neurological examination to the sophisticated neuroimaging scan, provides a unique piece of information contributing to the overall picture. Neurologists, like master puzzle solvers, must integrate the findings from each test, considering the patient's medical history, symptoms, and risk factors to arrive at an accurate diagnosis. This integrative approach is crucial for ensuring that patients receive timely and appropriate treatment, maximizing their chances of recovery and minimizing long-term disability. The process of integration often involves a multidisciplinary team of healthcare professionals, including neurologists, radiologists, physiatrists, physical therapists, occupational therapists, and speech-language pathologists. Each member of the team brings their unique expertise to the table, contributing to a comprehensive assessment of the patient's condition and developing an individualized treatment plan. The diagnostic journey for strokes and palsies can be challenging, but it is ultimately a journey of hope. By harnessing the power of modern diagnostic tools and embracing a collaborative approach to patient care, we can unravel the mysteries of these complex neurological conditions and empower individuals to reclaim their lives. Section 1. Strokes and Palsies, a Call to Action. We've journeyed deep into the intricate workings of the human brain, exploring the often devastating impact of strokes and palsies. We've seen how these neurological disorders, like unwelcome intruders, can disrupt the brain's delicate symphony, leaving individuals grappling with a range of physical, cognitive, and emotional challenges. But our exploration has also revealed a glimmer of hope. Just as a skilled conductor can guide an orchestra back to harmony, timely intervention and comprehensive care can help individuals navigate the aftermath of a stroke or palsy, restoring function and improving quality of life. The key to unlocking this potential lies in early recognition and prompt action. Strokes and palsies demand our attention, urging us to familiarize ourselves with their warning signs and act swiftly when they strike. Remember the acronym FAST: facial drooping, arm weakness, speech difficulties. Time to call 911, a simple yet powerful tool that can make a life-altering difference. But our responsibility extends beyond simply recognizing the signs. We must also advocate for increased awareness, research funding, and access to quality care for those affected by these debilitating conditions. Strokes and palsies are not merely medical diagnoses. They are human stories, each one a testament to the fragility of our neurological health and the urgent need for greater understanding and support. Section 2. The Ripple Effect: Impact Beyond the Individual. The impact of strokes and palsies extends far beyond the individuals directly affected, creating ripples that touch the lives of families, communities, and healthcare systems worldwide. These disorders, often striking without warning, can transform a family's dynamics overnight, requiring caregivers to shoulder the weight of their loved one's physical and emotional needs. The economic burden of strokes and palsies is equally staggering, with healthcare costs, lost productivity, and the need for long-term care placing a significant strain on individuals, families, and society as a whole. These economic realities underscore the importance of investing in research to develop new and more effective treatments, as well as preventive measures to reduce the incidence of these devastating disorders. Beyond the economic impact, strokes and palsies exact a profound emotional toll. Individuals may grapple with feelings of loss, frustration, and isolation as they adjust to their altered abilities and navigate the challenges of recovery. Family members, thrust into the role of caregiver, may experience burnout, compassion fatigue, and their own emotional struggles. Recognizing the ripple effect of strokes and palsies is crucial for fostering a more compassionate and supportive environment for those affected. By extending a helping hand, offering words of encouragement, and advocating for policies that support individuals with disabilities, we can help create a more inclusive and equitable society for all. Empowering ourselves, empowering others. Our journey reveals the complexities of the human brain and the impact of strokes and palsies. Knowledge, compassion, and commitment pave the way forward. Empowering ourselves with information is the first step. Understanding risk factors and treatment options helps protect neurological health. Knowledge is powerful, but compassion and support are essential. Our actions can make a world of difference. Together, we can create a future of hope and